With me is Brent Carter, and Brent is the manager of the whole organization that covers the individual policies for Blue Cross Blue Shield.
That's right, Bob. My team, we help people, consult with people, advise people on their options.
All right, now let's go to open enrollment for people that are under 65, for you young guys like you.
Yeah. So a lot of people hear the Affordable Care Act, the marketplace.
Right.
All of those terms are for what we refer to as individual coverage.
Okay.
Individual meaning they're not part of an employer group.
Right.
So that individual coverage, again, marketplace, the exchange, the Affordable Care Act, you can be on exchange or off exchange.
Right.
That open enrollment period starts November 1st and ends January 31st.
Okay, November 1, January 31. Now, this is for individual plans. That's one thing we've got to be really clear. If you're in a group plan, this does not concern you, basically, because your group is taking care of that. So if you're working for your employer, no matter who it is, and they have the Blue Cross group plan, it's nice to know this because you might have a friend that you can help with this. But this is for individual plans. And so then again, how many plans do we have under the is it still called a marketplace?
It is. It is. So we have several qualified health plans.
Right.
There's numerous plans to choose from. So more than the Medicare world that we just talked about.
Right.
But numerous plans to choose from, and you really want to look at, first deciding factor is look at your income level and your family size, because that's going to determine whether you qualify for a tax credit or subsidy.
That's important.
That's critical when you're in the individual market, is what do you qualify for in terms of tax credit and subsidy, because that can lower your monthly premium, and in some cases can also lower the deductibles and the co-payments.
So when you're looking at these plans on an individual basis and you're talking to people on the phone, or I guess that's another way of doing it, going to the website, I know when you go to the website, you can plug everything in and your income and everything, and it'll tell you what your subsidy may be and what your premium may be. It tells you all that. I mean, it doesn't. I say it may be because it could vary one way, a few bucks either way. Or they can talk to somebody on the phone for the same thing. Right.
Right. That's exactly right. There are tools on the website that will allow you to do an estimate.
Right.
Enter your demographics, your family size, and your income. And it will actually determine, kind of give you an idea of what that subsidy, what you qualify for.
And the subsidy also, there can be a subsidy, and that also affects the deductible?
Yes.
As well?
So it's driven off of the federal poverty level and where your income falls in relation to the federal poverty level.
Okay, and how many's in your family?
And how many, and the family size.
So if you got a husband and wife and 6 kids, it's pretty high. I mean, the threshold is pretty high. So more than likely, you're going to get some kind of subsidy and a lower deductible in a case like that. If it's just a husband and wife, not so.
Right.
Not as much. Because
and depending on where your income falls, again, based on family size and income, you could qualify for cost sharing reduction, which is lower deductibles, lower copays.
And that's actually built into the computer system when they go online. They can actually get an idea, and then you can make a decision. I know friends of mine that have done that. They've gone online, looked at what they had, looked at what they could get, and then make the telephone call and then sign up for it. But you can also sign up online. You
can do it either place, online or call. Either way, it's the same plans that are available.
And we haven't talked about the website or where they should go. Where should we send them? On the website?
Yes, Bob, you can go to our website, alabamablue.com, and there's health insurance plans, shop for plans, and that will take them to our shopping tool. There's also some links embedded into that where they can go to the marketplace directly from our website. They can go to healthcare.gov. And go directly to the marketplace to shop for plans. But
it seems to me that to get the correct estimate is to go to the Blue Cross Blue Shield website, because that way you can get such better service than you do from the .gov thing, as you probably all know that already. Well, Brent, I want to thank you so much for being with us. Great information. This is such an important thing coming up with these open enrollments. Just go to the website, browse around, have some fun with it, take a look, see where you are, whether you're going with an annual for 65 and over or open enrollment if you're under 65. But whatever that is, you'll be able to find it, and it'll be easy for you to find. And good luck with that, because this is what we're, I mean, the individual plans, there's a lot of them, people that need them.
There are, and I would strongly recommend that people go ahead and do their research.
Yeah.
Don't wait until the last minute.
Right.
Because every year, you get into December, that first week of December for Medicare, and really the whole month of December for individuals, it just gets hectic and chaotic.
Yeah.
The plans aren't going to change. The premiums aren't going to change.
Right.
So what is available at the start of open enrollment? Call, get some help, go online, do your research, but go ahead and do that ahead of time so you don't get caught up in that last minute rush.
And it'll be much easier on you too. Thanks so much.